Well, I like the fact that the question breaks it into two parts because, as you know, I kind of said in the introduction, like it or not, this world is divided into the clinical and the administrative. We like to sometimes pretend that it's not. Obviously, for me, the priority is always going to be clinical care, but I can't be so naive as to not recognize that the administrative end is what keeps the lights on and allows us to continue and practice medicine. So the answer to the question is it has a large impact on both. If you start with the clinical, the most accurate way to capture clinical intent is going to be at the point of care. It's the doctor talking to the patient saying, this is what I think is going on, and I'm going to capture that. After that, it's a game of operator. It loses integrity as it goes down the line. So obviously, if it's not captured accurately at the point of care, the obvious point is going to be that, it can impact because the correct diagnosis is not necessarily going to be captured. Think of diabetes as that. And diabetes is an example that's often used throughout these industries and discussions like this. And it's for many reasons. One is diabetes is very common. Two is diabetes has a huge range from people who are barely impacted to where it impacts every aspect of their life. And three, it's very complicated from a coding point of view, especially in the ICD-10 world. So diabetes is a good litmus test for how we handle things. So if I'm trying to relate information to a doctor, a specialist who's going to also be taking care of this patient, the transfer of information is critical.